Hi, I'm Terry Cooke. You're watching Hamilton's Vital Signs. Welcome to the new year. It's great to be back talking about things that are happening in Hamilton. And it is my pleasure to welcome to the show Carol Rand, the Director of Regional Programs at the Juaravinski Cancer Centre. That's close enough for government work, I'm hoping. And Dr. Bill Evans, who is both a board member at the Hamilton Community Foundation for the last couple of years, but is Professor Emeritus in the Oncology Department at McMaster University, and I think formerly the president of Juaravinski, now retired. Have I screwed up enough of the introduction so far to welcome you both to the program?
Not at all, and thank you very much for having us on the show,
Thanks for being here. I'm going to cut right to the chase because, Bill, you were interviewed in a series written by a mutual friend of ours, Steve Bust, the Hamilton Spectator. Steve and Neil Johnson did a number of programs around Code Red, poverty by postal code in Hamilton, and they had a part of that series on cancer and the relationship between income, neighborhood, and the likelihood of getting early diagnosis and effective treatment. And I know that that has been a passion and a part of both of your work. And I guess what I want to do is, before we delve into some of the innovative ways you're trying to deal with gaps in treatment and outcomes, is tell us how each of you, in the Reader's Digest condensed version of the story, came to do the work that you have both devoted a lifetime to doing. And Carol, I'm going to give you the opener. So how did you come to do this?
So I was hired 30 years ago, actually, by Dr. Bill Herenick, one of Bill's predecessors, and I was hired to work on the development of a research proposal for breast screening. And to make a long story short, that's what became the Ontario Breast Screening Program. So I was involved in developing that, and that was 1989. And we launched our first OBSP site in 1991 on Oak campus.
Okay, and give me the acronym for
Ontario Breast Screening Program.
Very good.
OBSP.
Yep.
Yeah, and then in 2000 we launched the Ontario Cervical Screening Program, and in 2008 the Colon Cancer Check Program, and I've been involved in screening and diagnostic assessment and everything else in between, I guess.
And born and raised and educated where?
I was born in Brantford.
Yep.
I did an undergrad at Western. I did a
my school.
Oh, very good.
Go Mustangs. We won the Vanier Cup. It's all good.
And I did the epidemiology and biostatistics master's program at Mac, and then a master's in leadership studies at Guelph.
Very good.
Yeah.
Thank you for being here.
Thank you.
Same question to you, Dr. Bill.
Gee, my interest in medicine really goes way back to grade 8, and frankly, it's parents who were interested in exposing me to different things, and at Christmas gave me a book on the human body, and a teacher who gave me time in class on Friday mornings to do whatever I wanted because I was doing.
What was the teacher's name and what school?
The teacher was Mr. Monday, and he gave us Fridays to do whatever we wanted, so it always sticks in my mind. And I really think that was the starting point, because I decided after doing that project that I was going to continue in medicine, or get into medicine. And every time I had an interview with the human resources folks and guidance counselors, they'd just say, well, what are you interested in doing? Medicine. And they look at my marks, and I say, well, your marks are okay. So, and then we talk about basketball. So that was the whole trajectory. Yes, absolutely. And so I went on to medical school. And initially it was just the interest in kind of the academic side of medicine. But again, it's role models in medicine are so important. And I encountered a wonderful surgeon, actually, in my internship, who had really tremendous people skills and who really taught me to relate to people, to enjoy the encounters with people, to be encouraging, supportive, even when they have dire illnesses like cancer. And that to me was really formative. And my career has been kind of a whole series of different steps, starting with an intense clinical practice and clinical trials work, and then evolving into increasing administrative roles, first in Ottawa, then at the Provincial Office of Cancer Care Ontario.
Easy for you to say.
Yeah, it should be easy for me to say. I said it only a million times in my life. And then coming to Hamilton in 2005 to lead the Cancer Centre here, the Juaravinski. And every one of those experiences has sort of given me a different perspective on the healthcare system and how it does some things very well and how it fails to meet the needs of many people. And I think people would say I have a passion for patients and patient-centered care. And one of the things I saw when I came to Hamilton was we do really good care in the Cancer Centre. But I would say to people, it's great that we do wonderful care in the Cancer Centre, but what about the people who don't get to the Cancer Centre? are the people in our Lynn, people in the inner city of Hamilton who don't get there in a timely fashion. And I must say, it's sort of the latter part of my career that was more of the focus. And one of the sort of the crowning things was this initiative to bring screening and care to people in the inner city with a mobile coach, which I'm sure you want to talk about.
And we are going to talk about that, but Carol, I'm going to put you on the spot first, because this is obviously public television. I'm certainly not a clinical expert. I know enough about the healthcare system to be dangerous. Sat on a hospital board once upon a time and have dabbled in it. But what do we know? Because you folks have spent a lifetime looking at the evidence and the outcomes. In terms of the relationship between screening, early diagnosis, and the likelihood that we're going to have successful outcomes. Because I think for many of us who read the Hamilton Spectator and care about the well-being of our community, when we saw the relative outcomes based on postal code, I think many of us were shocked, first of all, and taken aback at how we weren't doing a better job at ensuring equity of access and better outcomes for everybody. So talk to us a little bit about what we know about that.
Yeah, so we've been very interested even when we launched the program, because for the breast screening program to begin with, it was the first time in the province that there was a cancer screening program, and the first time in the province that a woman could refer herself. And some people might have thought that women would just show up for screening and get screened, and we know that that didn't happen. And so we actually did a lot of work looking in the literature and developed a research proposal on recruitment strategies, and we worked with family doctors. And in turn, those family doctors recruited their patients. So it was a letter of invitation. It was the single most important recruitment strategy. And even after all of that work, and actually that got adopted provincially, even after all that work and all these years later, the breast screening program, the uptake would be about 63%. Colorectal is 60%, and cervical is 62%.
Yep.
So to the mobile coach, we know that when we looked at our geospatial mapping, and we did this, well, probably about 10 years ago, started looking at our mapping, it overlapped with areas that were areas of low socioeconomic status.
Yep.
And so we know in our LIN that there are 5 areas that our uptake for cancer services was much, much lower.
So I'm going to ask you, Bill, to connect the dots for us. Because it isn't necessarily, as I understand it, a direct cause and effect. You can't say that because someone is lower income that they necessarily won't seek or get the treatment they need. But what do we know about how proximity to care, how access to primary care, how other factors within healthcare affect the ability of people to access the things they need in a timely way?
Well, there's so many issues you open up here. First of all, there's a broader issue of just health literacy. And so if you're in the lower socioeconomic strata, you probably just don't understand that much about your body, how it works, what signs and symptoms of illness are, what should take you to a family physician. You may also be someone who has a different language than the English or French in this country and have difficulty communicating your concerns, your health concerns. You may have come from a country where you had distrust of public institutions, including healthcare, and don't know how the healthcare system works here, and therefore don't seek it out the way many people who have, university educations and family doctor, long-standing, et cetera, would seek out healthcare when they have a symptom.
And are
so there's
comfortable self-advocating.
Right. And then you don't know the things that are healthy to do necessarily. So you find in the lower socioeconomic strata people who smoke more commonly. Because they don't have as much income, they can't buy some of the foods that are more healthy. We talk about having 5 servings of fruit and vegetables on a daily basis. Well, that's expensive. And so it's easier to buy cheap foods that don't have the right calories, don't have the right nutrients in them, and so this predisposes to illness, and it can be leading to obesity and diabetes, but those things also lead to certain cancers. So all these things get interwoven, and one of the things I find sad about the healthcare system in Canada, although it's great that we call it universal access, it's universal access if you can access it. And that requires initiative, it requires knowledge, it requires money. Even money just to get a bus to drive you a distance to get to a screening center, rather than the bus coming to you. And we have medical arts buildings, we have institutions, and we have private physician's office. We wait for the patient to come to us. And for some people, that's just not good enough because they don't know that they should come to you. They don't know even that they have a problem, and they certainly wouldn't understand what screening is in large measure. And we even use that term, and studies show that people don't understand what screening means. So if you put a bus even out there and say, this is the screening bus, well, that's nice. What's it do? Because they wouldn't have a concept of that. So there's a lot we have to do to build a bridge to folks who don't innately understand these things or haven't had the education in schooling that would allow them to appreciate what these services are.
Perfect. We're actually at a short break, but we're going to talk about the interventions and the Coach for Life when we return. I'm with Carol Rand from the Juaravinski Cancer Centre, Dr. Bill Evans, Professor Emeritus of Oncology at McMaster University. You're watching Hamilton's Vital Signs. I'm Terry Cooke, and we will be right back after this short break.
If you are ready to play, we are ready to pay. Kiwanis TV Bingo is coming your way. Pick up those $3 bingo cards at any one of almost 200 vendors around the Hamilton community. Tune into Cable 14 on Monday nights at 7 p.m. and win cash. Over $150,000 up for grabs this season. You won't want to miss it. Break a dabber.
You can never really be ready for the news that it's not an ear infection anymore, that it's cancer.
The Make-A-Wish Foundation gives hope, strength, and joy by granting magical wishes to children with life-threatening medical conditions.
Someone came in from Make-A-Wish Foundation, and they told us we were going to get a wish. Annabelle can play soccer, and she can do ballet. Everything seems so much bigger and better. Help us make a wish for a happy ending.
And we're back. I'm Terry Cooke. You're watching Hamilton's Vital Signs, and we're talking about cancer screening and treatment in Hamilton with Carol Rand from the Juaravinski Cancer Centre and Dr. Bill Evans from McMaster, Professor Emeritus at McMaster University. And we're talking about unequal access to care and unfortunately outcomes that are not as good as they can be, highlighted in the Code Red series that Steve Buist and Neil Johnson did. But you folks developed an initiative that was unique, that was groundbreaking, and that has made a profound difference here, and that is the mobile screening unit, the bus that travels to different neighborhoods and tries to bring early screening and intervention to patients that otherwise might not get it. And I want you to just take us back and tell us how that idea, that proposition, that notion came to be a reality. Tell us the story of that.
Well, there's a mobile mammography screening coach in the Northwest, up in Thunder Bay region. Yep. And that was going for about 10 or 15 years. And like I said, we were working on the hard to reach, the under never screened, that roughly 40% of people who weren't showing up for screening, and distance was an issue. We did get lucky with Cancer Care Ontario, and they offered us money to build a coach, and actually offered Northwest as well, so we worked collaboratively. But there wasn't a coach that addressed all three screening modalities. So we actually built it from the shell up. And so it has a mammography machine, it has a private room for Pap screening, and an area for counseling with the nurses do a cancer risk assessment. And they can give out an FOBT, a fecal occult blood test. So all three screening modalities are covered on the coach, and there's also smoking cessation counseling and referral for eligible people.
Tell us about the learnings and the implementation, because it's one thing to outfit a coach and staff it and take it into neighborhoods that perhaps have been historically underserviced. It's another thing to actually get people to come, and this wasn't necessarily a case of if you build it, they will come. There were some issues around navigation, as I understand, that you had to bridge in order to heighten the awareness and encourage people to take advantage of the opportunity. And Bill, can you talk a little bit about that?
Well, sure. First of all, we had to work with those communities at different levels, starting with the family practitioners who work in those communities and making them aware of the coach and encouraging them with their patients to refer to the coach. Secondly, was the community health centers and heightening their awareness. And along with that, the community development folks in there that Hamilton Community Foundation has supported over time. Because having those trusted individuals in these communities saying, this is a good thing for our community, this is something you should take advantage of, is really important. And then using media, all forms of media, so whether it's ads on bus shelters, radio, other forms of media, just to get the message out there. But I think more critical in probably all of those factors are the people who are on the bus. And we have an exceptional group of human beings on that bus. They are caring, compassionate folks who are colorblind, who are sensitive to the needs of folks. And you know, the letters and comments that they have received and Carol has received as a result of the encounters with some of these marginalized communities are so positive. So it really is building trust with individuals, and then that goes through the community as well. So that as individuals have excellent experiences, see the service and the care that's given, they'll talk to neighbors and others, and that builds the momentum. And so it's been a process of doing that over time. And Carol can speak perhaps more eloquently than I can, but you know, the special skills of this group were recognized in 2015 by Cancer Care Ontario with what we call a Human Touch Award. And one of the former chairs of the board of Cancer Care Ontario put in place this award to recognize the special skills of some of the care providers out there who are really connecting with the patients that we're trying to serve, or the individuals. These aren't necessarily patients, these are just individuals who are coming to be screened. But doing it in such an empathetic way that patients feel they've been treated really, really well.
Tell us a little bit about the access and the growth or momentum that you've built up through the kind of efforts and the kind and caring nature of the folks who are staffing the bus.
So we launched it in 2013.
Yep.
And as Bill said, it's the three-pronged approach. So working with family physicians, working with the community, working with the media.
Yep.
And it really takes all of those many, many times, you know, before someone might actually come on the coach. The importance of the people on the coach to build those trusting relationships. So we started in the lower city of Hamilton, and we actually built on the excellent work that was the neighborhood action strategy, and started in the McQuestion neighborhood.
It all did.
Yes, and you know, remembering David Derbyshire and
Pat Reed and a whole bunch of our friends who remain as active today as they were.
So they were
12 or 13 years ago.
They were hugely important in our launch. They were the champions, and we got working with them and working with public health, and he launched there. So we spent the first 2 years actually in the lower city of Hamilton, working across those neighborhoods, building up partnerships with all of the agencies, the Y, Good Shepherd, the community health centers, Urban Core, doing all sorts of work with food banks, with churches, because the staff actually refer patients to other services. You know, they come on for screening, but in fact often have other unmet needs.
Housing, food security.
Yeah, absolutely.
All those things.
Yeah. And some people don't have family doctors, so if we screen them, then it's important to attach them to a family doctor, and we've got wonderful family physicians who've taken on patients who've been screened and then need to be followed. So Hamilton was the launch, and that included Stony Creek and the East Mountain. We then went out to Six Nations and New Credit, and actually worked in a framework called Ways Tried and True, which is you know, using the cultural knowledge, building with the community partnerships, and that's been very successful. And now we've just moved out to Niagara, and so we've launched in Niagara, a similar kind of neighborhood to the urban core here. And next we will go out to Norfolk, Haldimand. So planning to really cover those pockets in our region that were identified. In our geospatial mapping and low screening.
That's fantastic.
Yeah.
So we've only got about 4 minutes left, and so I'm going to now put the skill testing questions to you. which is, I think all of us are collectively concerned about the social determinants of health and about how we as a community are performing on a range of different outcomes. And you know, the most shocking finding probably in Code Red was the life expectancy differential of 21 or 22 years between middle class or affluent neighborhoods and impoverished places. And given the innovative nature of the work that has been done here around cancer screening, I guess the question that I would put to each of you in 90 seconds or less is, what are the lessons that we can take from your work, from the interventions and the take the service to the people approach with caring and compassion, that apply more broadly to the way in which institutions interact with and provide timely and effective services to this community? Because it strikes me that there are lots of people of goodwill doing important work. I'm not sure we're getting the level of integration or early intervention that we need to get the kind of outcomes that you've been working on for some time. So what are the lessons for us as a community, Bill? And
it's nice that you asked such an easy question in 90 seconds. Well, one thing you already said, and we said too, is you have to go to the communities rather than wait for the communities to come to them. But you'd have to assess the needs of those communities. But what are we doing to bring knowledge about healthy eating? What are we doing about smoking cessation? Some of the key things that really contribute to ill health. But then you have to dig deeper. You know, why are people living in less than ideal circumstances? And it's their education, it's their employment. So we have to, at the same time we're thinking about the specific health needs, we have to be thinking about how to correct, to the extent possible, some of these social determinants of health. So initiative Hamilton Community Foundation of Abacus, trying to help youth that might otherwise fall out of the educational system and then have no really good future ahead of them as a result, trying to reverse that and to provide educational experiences that excite them and allow them to rise to their full potential, have employment that allows them to eat better foods, et cetera, et cetera. Everything's integrated here, and health can take a part of a lead in it, but it's not the whole answer. It's the educational system, it's the transportation system, it's the housing that they're living in, et cetera, that all have to be worked on by a community if it wants to try and overcome some of the deficits we see within our inner city in particular.
Carol, same question to you. What have you learned in the process of doing this important work, and how can it help us better understand how we work to have better outcomes for the entire community?
I think there's a tremendous amount of planning that's involved, regional planning, engaging all the partners. But at the end of the day, I really think it's all about the people. In the Cancer Centre, we say, you know, it's all about the patient. You focus on the patient. So this is really about the community. It's about building partnerships, working with people that we haven't worked with before with the Cancer Centre. Unusual partners for us, you know, food banks, housing and shelter, and those are the things that are really going to make a difference.
And on that note, unfortunately, we are out of time. Carol Rand from the Juaravinski Cancer Centre, thank you so much for being with us. Dr. Bill Evans from McMaster. The work you're doing is making a difference. It's inspiring to the community to think about innovative collaboration and the difference we can make. And I want to thank you both for your time today and for a lifetime of service to Hamilton. Thanks for being here.
Thank you.
I'm Terry Cooke. You've been watching Hamilton's Vital Signs. I hope you'll join us again next month when we talk again about things that matter in Hamilton. Take care. See you then.